Okay. Well, hello and welcome to today's webinar. It's entitled, Could the New Medicare Part D Changes Save You Money, right? And I wanted to remind you that all of the slides will be available after the presentation, and I'll be sending those out to everyone that has registered. And then also please excuse some of the background noise. We're having some construction done next door, so you may hear a couple bangs and saw noises, but know that we're all safe here and everything's good. So I am your host, Leslea Stock-Lopez, and we have a few guests on the line, and I really thank you. And of course, a lot of friendly faces, and it's great to see all of those who I'm working with, and I have the privilege to have a long relationship with, and so I thank you for that. So part of our work here at Star Group is to make sure that we address all of our clients' financial needs. And part of that is, how does Medicare relate to their overall finances? And so, because we've had a significant change in the prescription drug portion, or Part D, I felt that it was important for us to address what has changed and answer any questions that you may have. And I do have our Medicare Specialist here, Bill Hildebrandt, and he is going to talk about the new cost sharing rules and when the savings will start. Bill is a veteran veteran of the Medicare system, and he's worked with many of my clients to navigate through the complications of Medicare and also to provide the best advice for each person. So Bill, welcome. Say hi to the group.
Thank you for having me. I appreciate being here.
Hey, Bill, we're glad to have you. All right. Well, I'm going to start the slide presentation in a moment. And again, those will have the details that Bill's going to go over. But first, I wanted to take a step back and kind of talk about where Medicare is now regarding prescription drugs. And then you can really see the difference in the changes that will be coming up. So if we step back, so Medicare as an insurance program took effect in 1966, and it didn't include any provisions for prescription drugs. That was added in 2006 with the creation of the Part D prescription drug plan program. So Medicare enrollees with limited income and resources, they could seek financial assistance for their Part D premiums, and the cost sharing applied to these low income folks. And it was a program called Low Income Subsidy, or LIS. Sometimes it was called Extra Help. But according to the Kaiser Family Foundation, that only really affected about 25% of Medicare Part D beneficiaries, and that's as of 2021. So that left the remaining 35 million Part D beneficiaries with drug plans with no limits on how much they might spend in a given year. And according to AARP, 1.3 million enrollees spend more than $2,000 for their annual prescriptions, and that's as of 2020. So now that's about to change due to the provision of the Inflation Reduction Act of 2022. So the new law makes other changes to the program's Part D drug benefits, including limits to the out-of-pocket payments for insulin, and also making some vaccinations free. So as with many of the other provisions of this new law, the changes are going to be rolled out over time. And we will be talking about how that's going to be rolled out and what years that will take place. So I'm going to start doing sort of an interview with Bill, asking him about these changes, and he can explain those more fully. Right now, I'm going to share my screen again and put up the slide presentation. Okay. All right. So I hope everyone can see that. Can somebody give me a thumbs up? All right. Thank you very much. Okay. All right. Well, Bill, I'm going to ask you some questions here, and so that you can clarify those for us. And so the first question is, okay, so this is an exciting change for anyone who's on Medicare, especially those who have seen their prices increase dramatically. So when will the out-of-pocket costs begin to be capped?
Well, the really big news for Medicare beneficiaries is beginning in 2025, the maximum amount they'll have to pay out of pocket for prescription drugs each year will be $2,000. Here's a few important details. This out-of-pocket limit applies if you get your prescription drugs through a standalone Part D plan that people enrolled in original Medicare sign up for, or if you access your Medicare through a private Medicare Advantage plan. Most of those MA plans also cover prescription drugs. The amount of the cap could change over time. If what Medicare Part D spends on prescription drugs per enrollee increases, that $2,000 cap could increase as well. If your Part D or Medicare Advantage plan has a prescription drug deductible, that will count towards the cap. So if your deductible is $100, once you've met that, your out-of-pocket cost will be capped once you spend another $1,900 that year. In 2022, the maximum deductible Medicare allows a Part D plan to charge for an annual deductible is $480. Many plans have lower deductibles and some have absolutely no deductible whatsoever. In 2024, the year before the out-of-pocket cap takes effect, Medicare beneficiaries will no longer have any out-of-pocket costs once they enter what Medicare calls the catastrophic coverage stage. The way catastrophic coverage works in 2022 is that once an enrollee's out-of-pocket costs reach $7,050, they have to pay $3.95 for each generic drug, including brand name drugs that are treated as generics, and $9.85 each for all other drugs or 5% co-insurance, whichever is greater with no limit. But beginning in 2024, that 5% co-insurance requirement will be gone, and enrollees won't have to pay anything for the prescription drugs for the rest of the calendar year. Another change to the Medicare drug benefit that begins in 2025 is the requirement that Part D plans offer enrollees the option of what is called smoothed cost sharing. Now, this means you can opt to have your out-of-pocket costs spread out over the year. This is designed to protect people from being hit with such a big drug bill at one time that it may discourage them from even filling their prescriptions.
Right. And we've seen that happen before. So I really like that idea of the cost spreading. What about the premium increases? Is there going to be any help there? Will they be limited?
Yes, according to the new law beginning in 2024 and continuing through 2029, Part D premiums cannot increase by more than 6% a year. In 2022, the national average Part D premium is $33.37 a month. The amount of these premiums varies widely depending on where you live and what plan you select. There are 26 standalone Part D prescription drug plans offered by 10 different insurance carriers in Texas for 2022, with premiums ranging from $6.90 a month up to $154.90 a month.
Wow. So it's really confusing, and there's certainly a lot of different options that can be chosen. So someone like Bill is just the perfect person to kind of get in there and tell you this is the best bang for your buck, depending on your own prescription needs. So good job there. Thanks, Bill. You know, I know that one of the big areas of concerns for years has been insulin. Has anything been addressed there? Are they going to curb some of those expenses?
Yes, beginning in 2023, copays for a 30-day supply of any insulin that a Medicare drug plan covers will be capped at $35. Note that Part D plans will be required to adhere to that $35 copay limit, even if an enrollee has not met their annual deductible yet. The price could be lower if insulin becomes subject to negotiation with drug makers. Given that, although the monthly maximum copay will be $35 from 2023 to 2025, beginning in 2026, which is the first year negotiated prices would take effect, insulin copays will be $35 or 25% of the drug's negotiated price, whichever is less.
Right, right. And I know that negotiation is a big deal, and we'll talk about that in a moment. So we talked about insulin, and that's great news. What about vaccines? Any assistance there?
Yes, starting on January 1st, 2023, Medicare enrollees won't have any out-of-pocket costs for vaccines that the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices recommends for adults. Medicare Part B, which applies to doctor visits, diagnostic tests, and other outpatient services, already fully covers some vaccines, including flu shots, pneumonia vaccines, hepatitis B inoculations, and coronavirus vaccines, both initial shots and the booster shots. But other vaccines, most notably the expensive vaccine for shingles, are not covered under the Part D prescription drug plans. And many of those plans currently require enrollees to share the cost of those shots. Well, the new law eliminates that cost sharing beginning in 2023. When Congress added a prescription drug benefit to Medicare nearly 2 decades ago, the bill explicitly prohibited the program from negotiating with pharmaceutical companies for the prices of the life-sustaining drugs, that millions of enrollees take every day. Advocacy groups like AARP have made the argument for many years that with more than 50 million Americans getting their medication through Medicare, if the program was allowed to negotiate prices, the power of those numbers would yield a much better deal for Medicare beneficiaries and for taxpayers who ultimately foot the bill for the lion's share of the medication costs. Bill Sweeney, Senior Vice President of Governmental Affairs for the Inflation Reduction Act, for AARP, said, when we talk about the Medicare drug portion of the Inflation Reduction Act of 2022, the core component is the Medicare negotiation. That is the long-term solution to the problem that we've been seeing for decades, which is out of control prescription drug prices, end quote.
Yeah. I mean, that's a big deal. It's finally that they're going to be negotiating these prices. And of course, that helps all of us. So, Bill, how is that process going to unfold?
Well, to start, the U.S. Department of Health and Human Services, HHS, will identify the 100 medicines that Medicare spends the most on, and then decide which qualify to be in the first group of 10 drugs whose prices will be negotiated. Now, those qualifications are: one, the drugs can't have any direct competitors. That means there's no generic equivalent. And if it's a biologic drug, there can't be a biosimilar product. A biologic drug is a complex medication typically used to treat cancers and other serious illnesses. And two, the medications must have been on the U.S. Food and Drug Administration's approved list for many years. That threshold is 9 years for what are called small molecule drugs, medicines you typically get at the pharmacy and you take in pill form. Biologics must have been approved for 11 years to be eligible for negotiation. These two rules are the reason why some of the costliest drugs may not actually be among the first to have their prices negotiated. Here's a look at some of the medications that, as of right now, could qualify for the first batch. Eliquis is used to treat atrial fibrillation. Medicare spent the most on this medicine in 2020, $9.9 billion, than on any other single drug, and more than 2.6 million beneficiaries took the medicine. Januvia is used to treat diabetes. Medicare spent $3.9 billion on this in 2020, and nearly 935,000 enrollees took this drug. Standi is a cancer medicine. Medicare spent $2 billion on this in 2020, and 26,490 people took it. Myrbetriq is used to treat overactive bladder symptoms. Medicare spent $1.7 billion on this in 2020, and about 600,000 people took the drug. Orencia is used for rheumatoid arthritis. Medicare spent $1 billion to treat 29,764 enrollees in 2020.
Wow. Well, that's good to hear that these drugs, which many people are taking, are probably going to be first on the list. Okay, well, we're anxious to know when all these drug prices are going to go down. Do you have some timing for us?
Yes, the first negotiated prices will take effect in 2026 for drugs that are covered under Medicare Part D prescription drug plans. These are the prescriptions you typically fill at your pharmacy. For medications covered under Part B, which pays for doctor visits, diagnostic tests, and other outpatient services such as chemotherapy and other drug infusions at a hospital or doctor's office, negotiated prices will take effect in 2028. Here's the full rollout schedule. In 2026, a maximum of 10 drugs will be negotiated. In 2027, another maximum of 15 drugs will be negotiated. In 2028, another maximum of 15 drugs will be negotiated. And in 2029, another maximum of 20 drugs will be negotiated this year and every year after that.
Got it. Well, this all sounds terrific, but what if the drug makers, they don't want to play ball?
Well, under the new law, if the maker of a drug that was selected for negotiation walks away from the table, the government could levy a tax of up to 95% of their sales from the previous year. The idea behind that tax is to give the pharmaceutical companies a really strong incentive to participate in the negotiation process. The stakes are high. An analysis by the Nonpartisan Congressional Budget Office, or CBO, estimates that the provision allowing for drug price negotiations alone could save Medicare nearly $102 billion over 10 years. The analysis also debunked claims that drug negotiation would stifle pharmaceutical innovation and lead to far fewer new drugs being developed. According to CBO's forecast, of the 1,300 new drugs expected to be approved over the next 30 years, just 15 would not be able to come to the market as a result of the new law.
Wow. Well, this is all really great information, and it's a lot to wrap your arms around. And hopefully this presentation has allowed everyone to kind of get a sense of what's going to happen and somewhat of the timing. But I'm sure we would have some questions for the group, and so I'm going to end the screen share and open it up and ask if anyone has any questions specifically for Bill on what we went over today.
There aren't any questions on the chat.
Okay. Thank you, Christy. So anything in particular regarding the new law or anything for Medicare?
I think one of the most important factors with this new law is that it's going to be across the board. It's going to affect every Medicare beneficiary. Some people don't have a lot of trouble paying for their prescription drugs, but some people really do. And just because you're not having a high prescription drug cost today, unfortunately doesn't guarantee that you won't have higher drug costs down the road. So the fact that this new bill is going to be taking effect, and it's actually going to affect every single one of us that has a Part D drug plan, either as a standalone Part D plan or a Part D plan that's incorporated into a Medicare Advantage plan, it's actually very, very significant.
Right, most definitely.
A quick question on the cap, for the annual cap that goes down, if I understood correctly, from 7,500 to 2,000. Is that irrespective of the type of drug that you're taking?
I'm not sure I understood the question.
It was said that the cap or the annual out-of-pocket expense would go to $2,000, and this is irrespective of whatever type of drug you're taking?
Yes, that's correct.
Okay.
Right. So it doesn't have to be one of the approved drugs. Those are just the ones that are going to be negotiated. Is that right, Bill?
Yeah. The $2,000 cap. I mean, that is actually going to be for the negotiated prices. That's correct. That's correct. And so though there hasn't been a single drug that's been negotiated yet. Mm-hmm. But the rollout schedule is starting actually very soon, and 2020 and 2026 is going to be the start of the different negotiations. But the actual cap, the $2,000 cap, if I understand correctly, it actually does start in 2025. Is that correct? Leslea, is that what your notes show?
Let me take a look at those. Make sure I don't want to miss. Oh.
That's correct. And so
yes.
if the cap actually starts in 2025, that's actually going to be before the negotiations. That's going to be the current prices. So that's actually going to be more immediate help, because the rollout schedule is very important, but it's going to start with just 10 drugs. And then it's going to be 15, and then 15, and then 20, and then it's going to continue to be 20. But for this to take effect in 2025, and that is when it's going to take effect, the cap of $2,000, that's actually going to be even before the negotiations start. That's actually very good news.
Definitely. We have a question in the chat. So do you need to sign up for Part C and then Part D?
No, that's a very good question. Medicare actually doesn't require you to get a prescription drug plan. And when I say that, what I mean is they're not going to come take your house or your car or your dog or anything like that. They're not going to come get you if you don't get a Part D. The issue is if you don't get a Part D prescription drug plan when one's available to you, they will charge you a late enrollment penalty down the road whenever you do sign up for one. And you can get that either as a standalone Part D if you have a Medicare supplement plan or just original Medicare, or a Part D plan that's part of a Medicare Advantage plan. But you're not required to get a Medicare Advantage plan to get these benefits. The only way that you're going to have access to prescription drugs that are covered by Medicare is to sign up for a Part D plan that's either part of a Part C or part of a supplement, part of original Medicare.
Okay. So you went through a bunch of costs for Texas when you were talking about what the Medicare, what they cost. And so what is the most inexpensive one that you have found? And do you recommend that if somebody doesn't need it now, but might need it in the future and doesn't want to get a penalty, they get a really low cost plan?
I've got, there's several people that don't even take aspirin, to be honest. They don't take a single prescription drug. And so the question comes up, why in the world would I want to invest in a drug plan if I have no need for it? And the reason that you would get one when it's available to you, when you turn 65 or when you come off of group health insurance when you're past 65, is to avoid the late enrollment penalty. It's not bad. It's only $4 a year. But it mounts up over time. And the thing is once you have a late enrollment penalty, you pay that every month for as long as you keep your Part D prescription drug plan. So in just a matter of 5 years, you have a $20 penalty. Well, there's drug plans that are available for less than $8 a month. So if you're paying $8 a month for the drug plan, but $20 penalty every month, then you're spending a lot of money for a penalty that you could have avoided if you'd gotten an inexpensive drug plan to begin with.
Yeah, so that's what I was thinking, that you're kind of the first time you need it, you're really going to get hit. It could be a pretty high penalty.
And the thing is with the drug plans, it is not advisable to get a drug plan simply based on the monthly premium, because the very, very inexpensive drug plans work really, really well for low tier drugs, the preferred generic tier 1s and the non-preferred generic tier 2s. The low cost plans work very well for those. But if you're taking a number of brand name drugs, tier 4 and tier 5, you actually should look at some of the plans that cost a little bit more that cover the higher tiers more effectively. So it's not a matter of just what your monthly payment for the drug plan is the drugs you're taking right this minute. What is the drug plan going to make you pay as co-pays for that? And that's what helps decide what's a good drug plan. There is no one perfect drug plan. What you're looking for is a drug plan that works well for you based on what you're currently taking.
Right. And that's why it's so important to have someone like you, Bill, to help navigate this, because it can be confusing, depending, the tiers, where the drugs are. So that is quite helpful. Great. We have another question in the chat that says, from Sally, Medicare will only cover $40 for shingles now. Are you saying in 2023, Medicare will cover both shingles injections?
That's correct. Yeah. That's correct. It is any injectable medications under Part D are actually going to be eliminated just starting next year. So you're not going to have to deal with paying out of pocket for that.
Right. That's great. All right. Any other questions out there? Good questions. Yeah. I hope that this is going to be helpful to anyone who's currently on medication. And Bill, where can folks find information about changes to Medicare? Is there a source or a place they can go?
If you go just to the Medicare website, medicare.gov, that will help you find a lot of information, actually. And if you go to medicare.gov/publications, you can get a lot of downloadable information like this, which I actually just downloaded and printed yesterday. It's Medicare coverage of diabetes supplies, services, and prevention services. And so that is a great place to go for information. You could certainly contact an agent. An agent should be up to speed with what's going to be going on. It's always best to review your options and to understand what the difference is between different things. If you're new to Medicare, there's a world of difference between supplement plans and advantage plans. They're both excellent, but they do different things. And so you can actually go to Medicare.gov publications and get an explanation of how Medicare supplement plans work and how Medicare Advantage plans work. If that would help you, it's absolutely free to the public. I use it myself. I'm an agent, but it's still free to me too. So I use that as a resource.
Right. That's excellent. Well, I have put the Medicare website in the chat, and then I also put Bill's contact information in there in case you have any questions that we didn't answer today. And, if we see progression in this process, as far as the drugs that get approved, I'll have Bill come on again and we'll talk about some of the updates, but we know that's going to be a little while. But we'll keep you posted on any changes and anything that may be advantageous to you. And then if you have specific questions about Medicare, please don't hesitate to reach out to Bill. He is a world of resources. I mean, he knows a lot about Medicare, and I think that's you really need some expertise because it is kind of confusing. Yeah, great. All right. Well, I will be sending the slide presentation to everyone, and I really appreciate you participating today. And I thank you, and we will keep you posted on our next event.
Thank you very much.
Thanks, everyone.
Thank you.
Take care. Goodbye.
Bye.
Bye.
Bye, thank you.
Thank you. Mhm,
Thank you.
Bet.
Thank you.
Bye-bye.
Bye. How do we get out of here?
Meeting.
Well, let's see.